I'm going to show you something in this video that most doctors will never show you. A real patient's x-rays. Before and after years of doing exactly what you're probably doing to your neck right now. The changes are lasting and they happen faster than you'd think. In this video, I'm going to walk you through 5 specific things that you're probably doing right now that are silently making your neck pain worse. The frustrating part is that none of these feel dangerous in the moment. They're just habits. Normal, everyday habits. But stack them up over months and years, and they show up on x-rays in ways that can't be undone. The good news is, if you're watching this now, you probably still have time to change them. In this video, I'm going to show you the 5 most common things I see patients doing that are making their neck pain worse, including one that most people do right before they fall asleep without even thinking about it. I'm also going to show you real x-rays from a real patient that show exactly what happens to your spine when these habits go uncorrected over time. And at the end, I'll tell you about a free accountability tool I built specifically because knowing what to do and actually doing it consistently are 2 very different things. I've been a chiropractor in Denver for over 15 years, and I see these same patterns in my office every single week. I want to start with something you probably did within the last hour. You picked up your phone. Maybe you checked a text, scrolled a few minutes, you looked something up. Completely normal. But here's what happened to your neck while you did it. Your head, which weighs somewhere between 10 and 12 pounds, it shifted forward. And the moment it did, the load it places on your cervical spine, it stopped being distributed the way that it was designed to be distributed. Instead of that weight sitting back over your shoulders where your spine can actually handle it, it started pushing down into your discs. And that forward position accelerates the very degenerative process I'm going to show you on x-ray in a few minutes. The disc height loss, the arthritic changes, the bone spurs developing on the edges of your vertebra. And most people have no idea that it's actually happening because it doesn't hurt, at least not yet. So what do we actually do about it? Because I'm not going to tell you to put your phone down. That's not realistic and we both know it. What I am going to tell you is to raise it. Eye level every single time. It sounds almost too simple, but the mechanical difference between looking down at a phone in your lap and holding it at eye level is significant. You're taking that forward load off of your discs and putting the weight back where it belongs. 2 other things that make a real difference. First, use voice to text more than you think you need to. Every minute that you're dictating instead of typing is a minute that your neck is in a neutral position. Second, put your phone on grayscale mode. I know that sounds strange, but it works. A gray screen is less visually stimulating, you spend less time on it, and less time on it means less time in that forward head position. Your phone actually makes this easy. It's in your accessibility settings. Now, these aren't hard changes, they're just intentional ones, and intention is exactly what your neck needs right now, because here's the thing. The phone is only one place that your neck is being compromised. The next one catches people off guard because it feels comfortable. That's usually the warning sign. The most dangerous workspace I see isn't a poorly set up office. It's a couch. Ever since working from home became normal, I've seen a dramatic increase in patients coming in with neck and upper back complaints that didn't exist before. And when I ask them where they work, the answer is almost always the same. Couch, bed, kitchen table with a laptop sitting flat. Here's the problem. A laptop sitting in your lap puts your screen at roughly chest height, which means your head drops forward to meet it, which means we're right back to that same forward load on your discs, except now instead of a few minutes on your phone, we're talking about 6, 7, 8 hours a day, 5 days a week. Now, your spine is incredibly adaptive. It will accommodate whatever position you put it in most frequently. The question is whether you want it adapting toward health or away from it. The fix here is straightforward, but it does require a small investment. A laptop stand that raises your screen to eye level, an external keyboard so your hands aren't reaching up to type. Even a simple stack of books under your laptop changes the equation significantly. I've had patients who've made this one change and noticed a significant difference within 2 weeks. Not because it's a treatment, but because they stopped adding insult to injury every single day. Now, The next point is one that almost nobody thinks about because it happens in the dark, literally right before you fall asleep. I want you to think about what you did last night before you fell asleep. If you're like most of my patients, you probably grabbed your phone or a book, dropped a couple of pillows behind your head, settled in for 20, 30, maybe 45 minutes before your eyes got heavy. And the whole time, your neck was in this position, chin tucked down toward your chest. That natural curve in your neck, completely reversed. Every disc in your cervical spine under forward compression. Now, here's why this particular habit is especially damaging compared to the others that we've talked about. With your phone or your laptop, there's at least some variation throughout the day. You stand up, you move around, you change positions, but what happens right before sleep is different. Your muscles are winding down, your body's preparing to be still for the next 6 to 8 hours. And the last position you put your neck in before that happens, that's the position your muscles are going to start relaxing around. You're essentially asking your body to recover overnight from the exact posture you just spent 45 minutes reinforcing. I see this constantly. Patients who do everything right during the day and wonder why they wake up with a stiff neck every single morning. This is usually why. The fix is simple, but it requires breaking a habit that feels really good in the moment. If you're going to read before bed, and I'm not saying don't, but do it upright. Sitting up against the headboard with your screen or your book at eye level. Or, better yet, use that time to do something that actually helps your neck recover overnight, which connects directly to point 4, because what you do while you're sleeping matters just as much as what you do before it. Let's talk about what happens after you fall asleep, specifically the position your neck ends up in for the next 6 to 8 hours. If you're a stomach sleeper, I need you to really hear this one. When you sleep on your stomach, your neck has to rotate to one side just so you can breathe, which means for the entire duration of your sleep, however long that is, your cervical spine is held in a rotated, compressed position with zero ability to decompress. Think about that for a second. We spend roughly a third of our lives asleep. That's supposed to be recovery time. Time for your discs to rehydrate, for your muscles to relax, for your nervous system to reset. But if you're a stomach sleeper, you're not recovering, you're loading every single night. I have patients with chronic one-sided neck pain and stiffness that never fully resolves no matter what we do in the office. And when I ask them how they sleep, the answer is almost always stomach sleeping, usually with their head rotated to the same side every night. And years of that adds up. Now, I understand that position feels like something you can't control. You fall asleep one way, you wake up another. But there are strategies that help. Sleeping with a body pillow against your front side makes it physically uncomfortable to roll onto your stomach. Starting the night on your back or on your side with a proper cervical pillow, one that actually supports the natural curve of your neck rather than flattening it, trains your body over time toward a better resting position. Now, it doesn't happen overnight, no pun intended, but it does happen. And the cumulative effect on your neck over months and years is significant. Now, we've covered 4 habits that are working against your neck every single day, but the 5th one is different from the others because it's not really about posture or position. It's about what happens when you start feeling better and why that moment is actually the most dangerous point in your entire recovery. Here's what I see more than anything else in my practice. A patient comes in with real neck pain. We do a thorough assessment, we take x-rays, we find the actual cause, not just the symptom, but the structural reason why this keeps happening. We build a care plan around it, and for a few weeks, things go really well. They're keeping their appointments, they're doing their home care, their pain is decreasing, and then something shifts. They start feeling better. And the moment they start feeling better, the urgency disappears. They miss an appointment. They skip the exercises. They tell themselves they've got it from here. And I've seen this hundreds of times, and I understand it. When the pain goes away, it's hard to stay motivated around something you can no longer feel. But here's the analogy that I want you to think about. When a doctor prescribes you antibiotics, they give you a 10-day course. By day 4 or 5, you usually feel completely fine. The fever's gone, the infection feels like a distant memory, but your doctor tells you to finish the course anyway. Why? because feeling better and actually being better are not the same thing. The bacteria aren't gone just because your symptoms are. Stop early and they come back, often stronger and harder to treat the second time. Your neck works the same way. The pain going away is not the finish line. It's actually the beginning of the most important phase of your recovery, the part where we take the progress that we've made and make it lasting. What we're working toward is a neck that has its natural curve restored, discs that are properly hydrated and spaced, and a nervous system that isn't under constant compression. That's the destination. Pain relief is just the first mile. When patients quit at the pain relief stage, what they've done is invest time and money into feeling better temporarily. The underlying structural problem is still there and it will come back. It always comes back. And this brings me to something that I want to show you. These are real x-rays from a real patient of mine. I've known this person for years. Active guy, took good care of himself, came in periodically when things flared up. At some point in his life, things changed. Longer hours, desk work, the kind of daily grind that's hard on a spine. We made recommendations along the way, a full corrective care plan, specific home care protocols, the works. And he made the choice that a lot of people make. He did what his insurance covered, he came in when it hurt, and when the pain went away, he moved on. A few years later, he came back in. We took updated x-rays. And what I saw on those films genuinely concerned me. Significant disc space loss, arthritic changes on the vertebral edges, loss of the natural curvature in your neck that should be there protecting your spinal cord. Lasting changes that took years to develop and that we can't reverse. Now we can slow them down, we can manage the symptoms, but we can't give him back what was lost during the years he wasn't in corrective care. Now, I'm not sharing this to scare you. I'm sharing it because this patient's story is not unique. I see versions of it regularly, and the window to do something about it, the window where corrective care can actually change the direction of what's happening in your spine, that window doesn't stay open indefinitely. Now, here's the other side of this that I see just as often. When patients do commit to home care, they sometimes try to cut corners on the tools. We might recommend a specific cervical orthotic, something designed and clinically tested to restore the natural curve in the neck. And they'll find something similar on Amazon for $12 or roll up a towel and try to make it work. And I understand the instinct. Nobody wants to spend money that they don't have to spend. But a rolled up towel is not a Denny roll. A resistance band is not a prolordosis exerciser. The specificity of the tool matters because the goal is specific. We're trying to restore a precise curvature in a precise location of your spine. Generic solutions produce generic results. And when the results don't come, people assume the approach doesn't work, when really the approach was never actually implemented. So let me ask you something directly. Of the 5 things we've covered today, the phone posture, the laptop on the couch, the pre-bed position, the stomach sleeping, and quitting the moment you feel better, how many of them are you currently doing? If the honest answer is more than one, your neck is working against the headwind every single day. And no amount of adjustments or exercises is going to fully overcome habits that are pulling in the opposite direction. Here's what I've learned after 15 years of doing this. The gap between knowing what to do and actually doing it consistently is where most recoveries fall apart. You can watch this video, you can nod along, genuinely intend to change these habits, and by Thursday, you'll be back on the couch with a laptop on your lap, wondering why your neck still hurts. That's not criticism, that's just how habits work. They don't change because we learn something new. They change because something holds us accountable to the new behavior long enough for it to stick. So I built something for that. If you text the word NECKCARE to 720-782-0429, I'll personally check in with you every single day for the next 30 days with a simple reminder tied to exactly what we covered today. No sales pitch, no pressure, just a daily nudge from me to you to keep showing up for your neck the way that it needs you to. It's free, it takes 10 seconds to set up, and it's the closest thing to having me in your corner between appointments. Text NECKCARE to 720-782-0429 right now while you're thinking about it. I'll take it from there. Now, if you want to know what exercises actually help restore what these habits have been taking away, I put together a video on the 4 best exercises for cervical radiculopathy that you can do at home right now. That's the logical next step from everything we covered today. We identified the problem. Now let's give your neck something to work with. The video is right here. One last thing. If this video helped you, if something we covered today made you think differently about your neck, the best way that you can help pay that forward is to leave us a Google review. It takes about 30 seconds. It helps other people in Denver who are dealing with the same thing find us, and actually genuinely makes a difference for a small practice like ours. The link is in the description and pinned in the comments. I'll see you in the next one.